And ladies and gentlemen, we now move on to the last session of the day. That's the technical session 3. It's on therapeutic potentials of yoga with evidence-based research. I would like to first request our reporters to kindly be taking their seats. Requesting Dr. N. Shrikant, the Assistant Director, CCRAS, Dr. Rakhi Mehra, Assistant Director, CCRAS, and Dr. Bhandarkar, the Assistant Director of CCRYN. Ladies and gentlemen, the prophylactic as well as the therapeutic potential of yoga has been scientifically documented in several research studies across the globe. The objective of this session is to mull upon certain landmark research in yoga that has helped to generate scientific evidence on therapeutic potential of this ancient heritage. I would like to now invite here on stage our session co-chair, Dr. S.C. Manchanda ji. May I request Dr. Manchanda to kindly join us here on the stage. A senior consultant cardiologist at Sir Gangaram Hospital, formerly the professor and head at the Department of Cardiology at AIIMS, New Delhi. He has more than 40 years of experience across professional teaching and research and has authored 4 books on cardiology, including the Orum's Clinical Heart Disease, has many awards and honors to his credit, the most important being the Padma Shri in 2004. I now invite our speakers, Dr. B.N. Gangadhar, Professor of Psychiatry at the National Institute of Mental Health and Neurosciences at NIMHANS, Bangalore. He is recipient of Sir C.V. Raman Award and also the Doctor's Day Award from Karnataka government. He has guided more than 30 MDs and PhD trainees for research. He is going to be talking to us on the yoga therapy for mental health. And we now welcome on stage Dr. Nagaratna Raghuram. May I invite, she's joining us. Dr. Nagaratna Raghuram is Medical Director in S. Vyasa University at Bengaluru. She is the chief of the Stop Diabetes Movement of Vyasa and visiting consultant to a number of prestigious medical and research institutions of India and abroad. Dr. Nagaratna has contributed a lot in promoting the scientific aspects of yoga through publication of 43 articles, 11 books, and various audiovisual material. She is going to be speaking to us on the effectiveness of integrated approach of yoga therapy in lifestyle diseases and overview of the Vyasa research. Inviting our next speaker, Dr. G. Geeta Krishna. Dr. Geeta Krishnan is the head of Integrative Medicine Department at Medanta, the Medicity Hospital. He is an experienced clinician and researcher working in the field of integrative medicine since more than 10 years now. He has been awarded 1 European patent and 1 US patent in the field of drug research in type 2 diabetes. He is going to be speaking to us on the therapeutic potential of yoga with evidence-based research. And now inviting our next speaker, Dr. Ali Zafar Khan. Inviting Dr. Ali Zafar Khan. He is the head of Department of Minimally Invasive and Robotic Thoracic Surgery at Medanta, the Medicity, Gurgaon. He is a leader in the field of minimally invasive and robotic thoracic surgery. He trained and worked in United Kingdom as a cardiothoracic surgeon for about 20 years before returning to India to start the Department of Minimally Invasive and Robotic Thoracic Surgery at the Medanta, the Medicity. Dr. Khan has published more than 100 original research papers and chapters and delivered more than 130 invited lectures all over the world. We once again welcome all our speakers and the session chairs, and now I would like to hand over to Dr. Manchanda for the proceedings of the session. May I once again request people who are standing, please take your seats so that we can start with our session. This is the last session of the day, ladies and gentlemen.
Ladies and gentlemen, welcome to this very important session, Therapeutic Potentials of Yoga with Evidence-Based Research. Well, you know, yoga has been becoming very popular in the last few years, as International Day is being celebrated even today. And one of the reasons is that a lot of evidence-based research has come in the last few years, although more needs to be done. I am a cardiologist, and I'd like to take you back about 25 years back. Cardiologists never used yoga in their practice 25 years earlier. But one American gentleman reported, Dean Ornish, in 1990, in one of the most prestigious journals called Lancet, a randomized study which was an evidence-based study to show that the blockages in the arteries could be reversed by practice of yoga. One of the yoga gurus helped him in that program, and that is how a single evidence-based study, it was a very small study done in only 48 patients who had blocked arteries, and it set the way for many other researchers. A single good evidence-based research really changed the minds of many cardiologists, and over the last 20 years several cardiologists got interested into it. I have myself been interested in doing research in cardiology because I'm a cardiologist, and we have produced a lot of evidence-based research to show that it is possible to reverse even advanced disease. These were patients different than Dean Ornish because we had more than 80%. We have been able to save more than 50,000 patients from unnecessary bypass or angioplasty through this technique. We have also shown it is possible to manage early stages of high blood pressure, diabetes, and mental stress in these studies, although these studies were pretty small. And therefore, although the studies are small, but the implications are very large. Because you know, cardiovascular disease and the other chronic diseases are the leading killer of mankind all over the world. If we talk just of hypertension, every third adult in this world is suffering from this disease, and most of them are not aware. Majority of the people do not take the treatment in spite of the fact they know that they have high blood pressure because of several reasons. Maybe the side effects of the drugs, maybe they cannot afford it, maybe they think that because they have no symptoms they will not like to do it. And therefore there is a need of alternative systems. And that is why yoga has come into prominence, and in the last 20 years several hundred studies have been done to show that yoga could be beneficial in the management of high blood pressure. So much so that American Heart Association, the biggest association of cardiologists of United States, which has a very huge number of people, it in a scientific statement last year stated that there is enough evidence to show that meditation can reduce blood pressure, so it should be used. This is for the first time ever, and this is based on evidence-based research. So when an American Heart Association says that this is possible to control it, I think the cardiologists all over the world were moved up. Similarly, there has been evidence-based research in other lifestyle-related diseases. For example, the psychological diseases, the mental health and all. I was a member of one of the WHO committees on mental health in the South Asian countries, and we had several meetings, and I had suggested that mental health of the people is deteriorating. All of you know that, although physical health may be improving, but the mental health is deteriorating. To improve the mental health, WHO has several plans and several programs for the last 30 years, but they have not been able to improve it. So I suggested why not include meditation. And the committee unanimously agreed, and there is a statement which has also come out, to improve the mental health, we must incorporate meditation, of whatever type it is, because all have been shown to. So evidence-based research can change the policies, and it's possible that the mental health will change. Similarly, other lifestyle diseases like diabetes are there are joint pains, there are bronchial asthma is there, headaches are there, irritable bowel syndromes are there, and even part of cancer can be controlled by yoga. So a lot of data is accumulating, but still I think we are far away from reaching a consensus. The reason is so-called good evidence-based studies are still not available. What is a good evidence-based study? Is that which should be multi-central. It's called mega trials. One should really do, and that's what I would like to tell the Ayush people, that they should try to do multi-central studies, because many people who criticize these studies, they say, all right, it's possible in one center, but is it possible throughout the world? So therefore it's need for multi-central study. We need large number of people, and we need large number of follow-up. The outcome studies, for example, there is one study to show that if transcendental meditation is done for 7 years, the death rate in patients who have heart attack can come down by 48%. But one study. If similarly there is a need for more studies so that yoga can become more popular. Today we have 4 leading investigators who are going to tell us the role of evidence-based research in various aspects. And first I would like to invite Dr. Gangadhar, who is a professor and head of psychiatry. He's done a lot of work in mental health. He's a professor of psychiatry in NIMHANS, and NIMHANS has been doing a lot of work on yoga. So he's going to tell us yoga therapy for mental health. What is the evidence-based research so far, and what is needed to be done? Dr. Gangadhar.
Gangadhar. वो नहीं उधर है उसका. Yeah, Gangadhar last.
Being the last session of the day, let me focus on the issue of how to build evidence in practicing yoga. For example, in medical, this is the holistic health, with this task of demonstrating how yoga can be used for improving mental health in a diseased population. There is no reason to emphasize that yoga has had a tremendous impact on psyche. In fact, the very first aphorism of Patanjali refers to yoga on the mind, reducing the oscillations of the mind. So obviously yoga has been put to use for improving the mental health of those who have clinically become ill with either depression or with schizophrenia or with other conditions, for example, cognitive failure in the elderly. I chose these 3 topics essentially because schizophrenia is a very highly burdensome disease. Although it is a low prevalence disorder, it causes severe degree of burden to the family and to the society. Depression being a very common condition, I chose this as an example. And cognitive failure in the elderly population is going to be increasing over the course of years, and this burden of cognitive failure is going to be fought with, and yoga could be one such potential intervention. This is a study, a flowchart, which talks about how we investigated into the effect of yoga in schizophrenia. Patients who have been on treatment have not totally improved, been coming to follow up. The family continues to complain that they are still not totally well, the doctors feel that this is about it, we are given the medicines and nothing more can be done, and can we add yoga and get them to find more improvement. We have published this paper though. The findings were that addition of yoga for a period of 3 months, largely yogasanas and pranayama. We did not use any meditation in these sessions. Patients practiced under a trainer and then continued to practice it at home, and this was followed up by telephone calls to make sure that they were practicing, and a log was maintained. And when they were followed up, a group of people who received yoga, a group of people who received exercise, a group of people who received nothing at all were asked to wait until they are going to be recruited into yoga if they want at the end of their study. A randomized clinical design. We found that the symptom scores in patients of schizophrenia, although they were residual symptoms, the negative symptoms, which are a challenge to manage, got better over the course of 3 months with yoga, but not so much with exercise, and least of all with just waiting. Not just the symptoms getting better, their social function also got better with yoga, but not so much with exercise, and least of all with the not just the clinical symptoms got better, their liveliness, ability to emote with the family members also got better. One of the ways in which we test this is how effective is the patient's cognition to recognize emotions on others' faces. This is facial emotion recognition test, on which again we found that yoga practice reduced the errors of detection of emotions, the green bar. But that did not change. In fact, it got worse in those who were waiting or continued to simply do the exercise. How did yoga make the emotion recognition better? One of the hormones, oxytocin, has been implicated in emotiveness, warmth, the ability to cuddle. It's also called the cuddling hormone. And we found that in those who practiced yoga, the levels of, at the end of 1 month, the levels of oxytocin rose. In fact, oxytocin therapy has been introduced in schizophrenia to improve these social cognition deficits. What we do exogenously as doctors, oxytocin nasal spray, perhaps autogenously yoga is doing by elevating the hormone levels in the body. Not just the outpatients who are chronically ill and under treatment and have remained partially remitted are the ones who have the benefits with yoga. Even acutely ill schizophrenia or psychotic patients who were admitted in the hospital, acutely disturbed, the moment they were in a position to be involved into some yoga-based exercises and therapy, when they were included, yoga group vis-a-vis exercise, yoga addition made the symptoms fall better than non-yoga practice. So yoga could still be introduced in acutely ill psychotic patients when they are going to be receiving treatment in the hospital. It is not just patients of schizophrenia or psychosis. The family members who are being with them face burden and they are put to a lot of stress. They, when exposed to yoga, when they are coming in the follow-up with the patients, we ask them whether they would like to go through a yoga therapy session. And this, in fact, produced significant improvement in the relatives who have been put to burden with the chronic illness such as schizophrenia. So, schizophrenia has a comprehensive approach for schizophrenia management would include yoga. We also started treating depression with yoga. Our initial experiments using Sudarshana Kriya was extremely rewarding. We wanted to explore whether other generic forms of yogasana and pranayama, which also could produce similar effects. In fact, we did find that a set of patients who volunteered to receive yoga with the drugs if they wanted, and those who wanted only drugs, when you compared, the yoga effects were significantly better in lowering the depression scores. Please do not read this slide as a randomized controlled study slide indicating that yoga was better than drugs. I am not saying that, but yoga was significantly antidepressant in terms of reducing their depression scores. Very importantly, in patients of depression, the brain repair mechanism is compromised. There is a chemical called as the brain-derived neurotropic factor, which drops when the person becomes depressed, and the neuronal repair becomes compromised. And with the treatment and they getting better, these levels of the brain-derived neurotropic factor increases, and yoga makes it even better. The levels of the brain-derived neurotropic factor increase substantially following yoga, either given alone without any medicine, and even when it is given with medicine. Very interestingly, the degree to which their antidepressant effect gets manifested is related to the degree to which the BDNF levels increase in the blood. The red line shows a linear relationship. In the group of people who were treated only with yoga, the levels of increase in the BDNF was correlated significantly with the levels of drop in the in the depression scores. There is a relationship to stress and depression. The stress hormone cortisol is elevated in depression following treatment either with the drugs with yoga or yoga alone. The number of people who at the end of the treatment have a reduced levels of cortisol is higher in those who were treated with yoga than when they were treated with only drugs, which means the stress mechanism is curtailed with the introduction of yoga, and this also is significantly related to the antidepressant effects of yoga. The degree to which the cortisol drops, the same level to which the depression scores also drop. Very interestingly, in those people where the cortisol levels dropped, the black line above, the BDNF levels rose significantly, which means the neuro repair mechanisms through BDNF was also perhaps related to the reduction of stress and so the reduction of cortisol following yoga. The red line indicates in those groups where the cortisol levels did not fall, the BDNF levels continue to drop over the course of the 3 months of the study. Again, the BDNF levels, which I am talking of neuronal repair, if it is substantially increased, the brain processing speed becomes faster. The time they take to solve a riddle, cognitive riddle, becomes faster if they had a higher levels of BDNF elevation in their blood following yoga. The red line indicates the yoga group. Amongst the yoga practices in depression, one of them we use is Om chanting also. This is a study using the functional magnetic resonance imaging, which shows when the chanting of Om happens, there is a hypoactivation of some of the regions of the brain called the limbic areas, which are usually hyperactivated when there is an emotional charge, including depression. Particularly the cingulum, which is hyperactivated in depression, could potentially be calmed down if Om is chanted. This slide or this study is in healthy population. I guess the same would happen in the ill population who have a pathological limbic system. Cognitive failure in the elderly, healthy subjects otherwise, but are experiencing early cognitive failure called as the mild cognitive impairment, which a good amount of them can progress to dementias. When these people were exposed to a 6 months yoga, there was a significant elevation in their cognitive function. There was a significant improvement in their quality of life, and then there was a significant reduction in their sleep symptoms, the blue line. More importantly, in these people, A small number though, I want you to take this data with some caution. 7 subjects, healthy subjects who practiced yoga. All these people were elderly, 65 plus, and at the end of 6 months, we did a scan before and after. A region of brain called as hippocampus, which is vulnerable to aging process and decays over the course of time, and more rapidly once we reach senescence. In this slide, in this study, we found that at the end of 6 months, the hippocampal gray matter actually had increased significantly. The white dot you see is a statistical indicator that there is an increase in the gray matter in these elderly individuals. So it's possible that yoga practiced either in younger days or even in the elderly could possibly retard neurosenescence, which is a question that we need to investigate more elaborately. So in summary, yoga has an important role in schizophrenia, reducing their negative symptoms, improving their emotiveness, also reducing the stress in the family members who are looking after these patients of schizophrenia. It is helpful in depression, not just reducing depression, also reducing the biological correlates of depression, the stress hormones, increasing the ability to brain to repair, the BDNF levels having increased. All these things are related to the antidepressant effects of the yoga. In elderly, yoga has produced improvements in quality of life, improvements in neurocognition, reduction in sleep pathology, and also possibly increases in some gray matter volume, suggesting that it could retard neurosenescence. Why is all this data important? Typically in a mental health team, all these days we had a psychiatrist, a psychiatric social worker, a psychologist, and a psychiatric nurse to be able to manage the patients both in the hospital or in the community. It is possible with more evidence cropping up. We probably have to include a yoga therapist also as a part of the team of mental health team in the care of patients in the hospital and in the community as well. I need to thank several people who have helped me in conducting all this research. Of course, there's much more research, but I chose some of the highlights because we had just 15 minutes of time. Much of this data has already been published in a supplementary edition of the National Journal of the Indian Psychiatric Society, the Indian Journal of Psychiatry, and has been well cited already. I thank all of you. If there are any questions, please go ahead and send any feedbacks onto the email I have shown here. Thank you.
Thank you very much, Dr. Gangadhar, for your outstanding, although small, but a high quality evidence-based research which has been published in peer-reviewed journals. This is the type of research really we need. He not only showed that the patients benefit in like schizophrenia and depression, but also went to the biochemical aspects, that oxytocin increases and so on. So this is the type of research we want. And if with this type of research is there, I think it will be acceptable more and more to the clinicians and all. We will have questions at the end, but our second speaker is Dr. Nagaratna. She is the Dean of Swasa University, and Swasa University is one university, I think, in the country which has done the largest amount of evidence-based research in the field of yoga. She and Dr. Nagendra have been really involved for the last 30 years in doing outstanding research which has been published, and she is going to tell us the overview of the Vyasa research in lifestyle-related diseases. I'm sure they have a huge amount of data, but she will try to summarize in the next 15 or 20 minutes. Dr. Nagaratna.
Namaste, good afternoon or good evening. Namah Shri Yatirajaya Vivekananda Suraye Satchit Sukhaswarupaya Swamine Tapaharine Yoga Day, bringing the greetings from the Swami Vivekananda Yoga Research Foundation to all the delegates. As we have been talking about the preventive, promotive and curative aspects of yoga, we know that we have moved a long way from managing communicable diseases to non-communicable diseases, which have become a major challenge, for which we know the reason is the lifestyle. In lifestyle, the four things: the wrong diet, lack of exercise and the sedentary lifestyle, bad habits like drinking, smoking, and mental emotional tension, all traceable to the mind, and therefore for all these non-communicable diseases, we have recognized that mind is the root cause of the problem, and therefore yoga becomes very, very relevant, because the yogis, the scientists of the Indian soil, have made 5,000 years of research about understanding mind, what are the components of mind, how to handle mind, how to change the mental makeup, etc. And we can say that all stress is traceable to persistent, long-standing negative emotions, which the sages classified under 6 major enemies of mankind: Kama, Krodha, Lobha, Moha, Mada, Matsarya, which are all having one common factor, and that we can call as stress. And in stress, normally when I ask my patients, I am a clinician working in a 250-bedded hospital where we admit patients for integrated yoga therapy over the last 35 years. And when we ask the patients, what are your stresses, they start making a long list of, okay, I have a big problem in my office because I am an young, energetic, dynamic, progressive boy who needs to really grow. Big demand, big stress, big challenge, big targets, big deadlines, or problems in the family, or problems with finances, etc. But in the very first part of their stay, we make them understand that it is not the situation that is the problem, but it is how we respond to the situation, how we react to the situation. And in all these reactions, which could be called as stress response, many a times these are necessary responses which help us cope up with demanding situations. Whenever there is fear, anxiety, we have heightened alertness, and all the organs work at a heightened level, and we know the whole endocrinal mechanisms that are involved in this response pattern. And what is happening in today's lifestyle is there are too many of these demanding situations which we have become habituated to, and we do not have time to get back to normalcy. And these persistent, long-standing stresses are the ones which is causing excitement, stimulation, activation, forgotten to come back to normalcy. And that persistent, long-standing, habituated response is what becomes an illness, is what we have understood through present-day medical science. But what is the additional component of yoga? In yoga, we have 2 major components, concepts which we have used in evolving our so-called integrated modules. One is the 5 aspects of our personality, where we know that the illness, biochemical change or physical change, symptoms, pain, etc. are at the physical level, which is only one aspect of our personality. We have 4 other aspects of our personality. The prana, the life energy, which our Krishna Madhapa has started to document in the form of prana energy, which is the more subtle aspect of our existence which guides our body to do its job, and the mind, the perception, emotion, etc., behind which we have our knowledge base, the Vijnanamaya Kosha, which guides us to do a thing or not to do a thing and help us to behave better. And that's what yoga is meant to help us to achieve. And through that, we achieve a state of deep inner quietude or ananda or bliss. I'll quickly give you an example. I had a patient who had hypertension. BP was going up and up and up. He came to our campus because his medication was increasing, and fourth day of his stay in our campus, his blood pressure dropped drastically. And I asked him, "Sir, tell me, why do you think your BP has come down so drastically?" He did not increase his medication. There was no cardiac problem that happened. He says, "Madam, first thing in the morning in the campus, we have wonderful Om meditation that happens for half an hour. And this morning, when I was doing my meditation, Om meditation, which is a part of the integrative program, I felt something very unusual." What is that? When I opened my eyes after when the class was going on, everybody had left the hall. I was alone. And I said, "Maybe you had slept early morning." He says, "No, ma'am, I did not sleep." He says, may note this sentence. He says, "I had become Om. I had merged myself in the deep inner quietude of blissful experience, the Anandamaya Kosha, which I enjoyed so much that the whole day was reverberating with Om. It was my whole body was Om, and the whole of the campus was Om. The whole space appeared to be reverberating with Om. And I am very, very blissfully quiet all morning, all day today. And do you think that maybe the reason why my blood pressure has come down?" He says, "What better thing?" So we help our participants to read that Anandamaya Kosha and reduce their stress level. According to yoga, the definition of stress is nothing but uncontrolled, violent repetition of sentences in the mind. So these negative emotions, which are persisting, long-standing, suppressed, which are deeply violent reactions at the mind level, speeded up reactions, are the ones which settle down in the body as inflammation. Now, most of the diseases of the non-communicable type we see, starting from cancer to atherosclerosis to chronic back pain, are all traceable to inflammation, inflammation, inflammation. What is inflammation? A fighting, a violence, a speed. So the speed at the physical level is a manifestation of the violent speed at the emotions, and therefore we explain to our participants that the answer is emotional stability. Manaha prashamana upayaha. We always emphasize this word prashamana, slowing down, calming down, relaxation, rest, and through that reach a state where we can move on to a deeply rested state, which we demonstrated. If you sleep for 6 hours, you get about 9% reduction in oxygen consumption. But if you do this deep meditation called cyclic meditation, you come to a 32% rest where you get into wakeful sleep. That's what is yoga nidra. Wakeful sleep is the deep relaxation that we see, and that's what all the morning speakers have been talking about. And for that, we use all these techniques, change their diet, cleansing techniques, physical practices, pranayama, meditation, devotional session, notional correction, and yogic concept of diet we explain in great detail, where we understand the effect of mind on food on mind and help them to go into that state. Then cleansing techniques, Uddiyana Bandha, Naudi, then come to specific asanas, specifically designed for a particular disease, then go on to pranayama, where we correct the prana imbalances by doing breathing exercises, deep, slow breathing, mastery over the excessive, violent activation of prana, and help them to go into deep state of deep rest, relaxation, calming down, and enter into a deep mood of divine mood of love. And that is what is the greatest technique of bhakti yoga that we teach all our participants, and finally take them to a state of deep internal silence. Turn the mind inwards and achieve that deep internal silence is the mechanism which we are using in our center to move towards what we have been seeing as fascinating results through yoga therapy. And I am glad to share that we now have one of the state-of-the-art laboratories which is able to track all the changes in various areas in the molecular biology department, microarray and gene expression studies. We can do autonomic function test, exercise physiology, sleep laboratory, cognitive neuroscience laboratory, etc. So let me quickly take you through some of these studies where this is one of the collaborative researches that we have, a $4 million project of 5-year duration, a randomized control study in collaboration with MD Anderson Center, the largest cancer hospital in the world in Houston, where it's a 5-year follow-up. We are almost nearing the end of the study. So here we use a very simple set of yoga practices in breast cancer ladies undergoing radiation therapy. What did we notice? This is a small part of the result. Based on this, we have proposed this new study which I mentioned just now, RO1. The general health was better in the yoga group, physical functioning was better, benefit finding was better. Then, as I said, we have gone on to the further studies where we were able to show the benefits of better quality of life. Physical functioning was better in the breast cancer ladies where we had add-on yoga. Fatigue was much lesser. Cortisol rhythm was much better in the yoga group. Moving on to asthma. Our very first publication on asthma was published in British Medical Journal in 1985. The longest duration of follow-up. We had a 56 months follow-up, 54 months follow-up, a controlled study. Now, based on that study, we designed another randomized controlled study. We took 40 and 40, followed them up 4 months, and this was a PhD project where we were able to show again the same result, that the inhaler score requirement was much lower after 4 months in the yoga group in asthma patients. Oral medication scores were much lesser. The lung function was much better in the yoga group. Asthmatics learn how to tolerate the irritant. The yoga, we say, is going to bring about balance, but it also brings about tolerance power. We saw that beautifully in the cold tolerance in the arm soldier study, high altitude study, tolerance to cold, tolerance to changes. This is exactly what we found in asthma also. As they practice yoga regularly, their ability to, I remember one patient who had come to us simply because all her food, she had to go on stopping, and had come to a stage where she was only living on coffee. Morning coffee, afternoon coffee, evening coffee, because she can't take any other food. She can't take direct milk, she can't take rice, she can't take wheat, she can't take any of the vegetables, slowly, and therefore she had become so malnourished, and this person slowly started developing capacity to accept. The body is made to accept the so-called allergen, so-called allergic substance to which they were allergic to. So the body starts accepting the dust, the weather changes, the food items, etc., and even the pollution. And that's how this tolerance power, titiksha, is a Samskrita word for that. In cardiology, Dr. Manchanda's study has been widely quoted. We are very near Narayana Hridayalaya, where we conducted a study in post-bypass patients, where we were able to show, apart from the reduction in the BMI, the ejection fraction had improved better in the yoga group, in those who had low EF after 6 months. We have a collaborative work going on with Germany, where in a neuro rehab center in multiple sclerosis patients, we conduct studies, and in these wheelchair-bound German patients, our student exchange program takes our MD students there for 3 months, and they design specific techniques for these people and teach them yogic practices. And we were able to show in this particular paper on the post-void volume urination that could reduce. Most of these people have a lot of problem with urinary frequency, urgency in the night, and their sleep was getting disturbed vigorously, very badly with the regular lifestyle and all the intervention that they were getting. When they added yoga, they were able to sleep better because the urinary frequency reduced and the post-void residue reduced. And this gentleman comes to our campus repeatedly, and he is now able to translate many of our techniques. One of the specific techniques that multiple sclerosis patients like a lot is called pranic energization technique, and we have been using that. We see medical miracles in our campus. This was a post-head injury patient. 6 years after that, he didn't have confidence to move around, and within 1 month he is running and climbing up and down the stairs like an young man. So these are some of the things that we see as dramatic changes in our neuro rehab center, and we are very happy that our Dr. Nagaraja is with us now. I'm sure we are going to evolve this neuro rehab center to include more of the integrative medicine, and we should be able to produce many more interesting results. Yoga for menopause is one of the studies from one of our friends who comes to MDNIY regularly, Dr. Ritu Chatta, and she showed better vasomotor function, psychological symptoms, urogenital symptoms. Neuroticism was much lower and their cognitive functions were much better. Autism is another area where lot of difficulty is there to teach these children. Very, very difficult. This is a 2-year follow-up, a PhD project where our researcher was able to show that the children had much better eye-to-eye gaze. Their sitting tolerance was better after yoga for 2 years. Body posture was much better. Body awareness was much better. And depth perception and balance was much better. Imitation skills they were using now for better learning. Although these children have a lot of repetitive movements which are useless, now they are applying that to imitate the teacher so that their learning becomes better. I cannot stop without talking about diabetes. We started our very first work with diabetes with a publication in British Journal of Complementary Medicine of our small study in Royal Free Hospital, London, where we were able to show significant reduction in the glycated hemoglobin and medication score, and we went on to a randomized control study where 2 groups, yoga, non-yoga, 150, 12 months follow-up, 1 hour exercise supervised every day in one group, and 1 hour yoga every day, one group for 1 year. And both of them were monitored very, very carefully, and we were able to show that yoga was better than exercise in increasing good cholesterol, decreasing the bad cholesterol, and decreasing the medication requirement. So based on all this, these are a slide about all our courses. We have BNYS course, medical degree, Bachelor of Naturopathy and Yogic Sciences, MD degree, MSc degree, BSc degree, PhD. We have about 110 PhD students who are working with us, and they all stay in the campus with a Gurukula type of education, best of the East and best of the West, and they share the ideas and go on. Based on our research of 30 years of our benefits, we want to take this to the common man, and therefore we started this nationwide movement called Stop Diabetes Movement, which is a collective effort to prevent India from becoming the world capital of diabetes by 2025. Our aim is to bring down the curve, and we started with many awareness camps, and I'm glad to share that as a part of the International Day of Yoga, we have started several camps around the country, in all the states of the country, in all the state capitals and district capitals. There is a lot of enthusiasm in an association with an organization which has got infrastructure of teaching yoga to people around the country. In 2,000 camps around the country, the camp has started yesterday, where we are introducing the benefits of one module for which CDs have been produced, which is going to be followed up for 1 year. With this, I welcome all of you to be a part of this Stop Diabetes movement as a community of yoga promoters around the country, so that we can see that India becomes free from becoming the diabetes capital of the world. Thank you very much.
Thank you, Dr. Nagaratna, for your outstanding deliberations. I think she has so much to report that this is only a glimpse of what they have been doing for the last 30 years. They have taken up the most difficult diseases to treat, like multiple sclerosis, autism, and cancer. And I think yoga is a universal discipline. We are all hearing it, but this is the universal approach for doing research. They have collaboration with Anderson University in the United States. They have it with Germany, with Royal Free in England. I think to solve the problems of the mankind, I think we should all unite, not only in doing yoga, but also in trying to find out how yoga helps. That is how it will be acceptable. Thank you once again for your outstanding presentation. And we now move on to Dr. Geeta Krishnan, who is head of Department of Integrative Medicine in Vedanta Hospital, Gurgaon. Vedanta Hospital is one of the best tertiary care hospitals. They are doing state-of-the-art surgeries, transplants, and so on. It's one of the best hospitals. But even doing so much of the allopathic medicines, including so many bypasses, knee replacements, liver transplants, they have also developed a department of integrative medicine, because if you want the best, if you want to give best to the mankind, you have to give the best of ancient wisdom, which is yoga, Ayurveda, etc., and the modern medicine also, both combination. This is called integrative medicine, very popular abroad, but I think very few hospitals in India have it. So I present to you Dr. Nagaratna, who is going to tell us the evidence-based research which is done. Dr. Geeta Krishnan, sorry, Dr. Geeta Krishnan, who is going to tell us evidence-based research which they have been doing there. Dr. Geeta.
Respected Chair, dignitaries on the dais, my friends, it's a privilege to be here to speak about the programs or work which we are doing at Medanda, and my topic is therapeutic potentials of yoga with evidence-based research. And it's very clear we are trying to give you an account of my experiences at Medanda, trying to create integrative medicine, adding yoga to tertiary care, therapies offered to the patients in the hospital. Medanda is one of the largest hospitals in the country, and we have a huge, group of doctors, physicians who are, and surgeons, and the best of the lot in the country working with us. And I have been very fortunate to work from the very beginning with this hospital, from the inception of its concept. And we have been working together to find out a way for creating integrative medicine. So even before the hospital started, even before the department started, for about 2 months or 2 years, we were actually working on how to create a concept for integrative medicine. After looking at several models across the globe, we have finally come to the conclusion that the best option is to look at it from the point of view of the patient, and therefore the aim of integration is to offer the best possible cure, care and management to the patient. This was told to me by the chairman of our hospital. He said, don't look beyond that, that's the most important thing. And therefore I bowed to him, Dr. Han, who had given me this opportunity to work in this direction. Let me go straight away to what and how we look at yoga. So for us, we understand yoga from a perspective of what it means to add it in a therapeutic language or therapeutic process, or a paragraph of language which we are trying to express to a patient. We think that every life is the synchronized dance of 5 elements deliberately brought about by consciousness. That's our first thought. Conveyed through the medium of mind, the 5 elements assimilate from the environment and disperse back during the short and temporary phase of time called life. The structure which the assimilated 5 elements take is the body. So there we have the consciousness, the mind and the body. And yoga, we find, is an excellent tool which can synchronize the consciousness, mind, body triad to align itself with the environment, so that the dance of elements forming life continues unabated and as natural to its prakriti. So it cannot be separated. Yoga cannot be separated from the other Indian sciences. So it actually is a mix of many things which happens together, but yoga is very important. What is our approach towards integrating yoga? We see it in 3 different areas. One is body, the body and the mind and the consciousness. We can actually, when we sit in a clinic and try to separate out these different kind of patients who come to you, who are very, very sick, we can find that there are 3 different kinds of patients which we can actually look at from the point of view of yoga. If you look at body, which is the external force, which is a physical form of what you see in a patient, is, you can say, for example, vertebral disc diseases or osteoarthritis. They are typically more of body oriented rather than mind or body or mind or consciousness oriented. They are part of your wear and tear, which happens as a normal part of your life. If you look at body and mind, then you have diabetes and cardiovascular diseases, which are very, very prevalent, and two of the most killing and non-communicable diseases in the society right now. Then comes mind and consciousness. If you look at mind and consciousness, we think that stress response, it is not stress which actually creates a problem, it is your ability to respond to it. So stress response and cancer are these are only examples. 2 examples of what you can look at as part of mind and consciousness, what you can look at from the mind and consciousness point of view in management or adding yoga. Well, how do we factor yoga into a therapy? We look at it from 7 different aspects. We of course look at consciousness, mind and body, but at the same time we think that there are 7 different aspects which we can look at, which can shed light into the fact whether it should be a mind-body or mind-body together, or is it a consciousness and mind kind of a therapy which we should apply for a particular patient. So when we have Srotas, Bala and Prana, which is very, we can definitely say that they are part of all the 3, consciousness, mind and body. It cannot be separated from that. But if you look at Agni and Dosha, we will have a better clarity, saying that it is more related to mind and body rather than to consciousness, because it's more physical. It is becoming more and more physical. And once we come to Prakriti, it is very clearly it is consciousness. And if you come to Dhatu, it is basically more of body. So it is we can look at a patient from all these different aspects and decide what is the kind of yoga therapy which we can create for a patient. So how do we integrate in Vedanta? We have a 3 simple technique of integration in Vedanta. When we start practicing straight away, when we started the hospital and I went to Dr. Trahan with a lot of clinical trial programs, I had taken, or fortunate enough, I had been given a lot of leeway to work around, try to look at different people working. And I went to him with several different, like clinical trial options. He said, are you practicing? Are there thousands and thousands of people practicing in India? Are there lakhs and lakhs of patients being treated and cured? Then why don't you start practicing? Create the evidence, and then we will go back and look at the clinical trial aspects of it. Because we have one of the best clinical trial facilities in the world. It is not the lack of facilities or lack of manpower that we think we are not worried about. What we are worried about is why are we delaying the profit of what is known already being given to the patient, being delivered to the patient? That was his question, and I agree with that completely. From parallel practice, where we create a lot of evidence, actually real clinical evidence, from our own experience, which is known, which is collected in the hospital information system on a regular daily basis, which is analyzed on a monthly basis, we go into complementary practice. We have evidence, we create evidence. Then I go to my senior colleagues like Dr. Khan and tell him that, sir, there is a possibility that I could be able to help you in this particular area. And then we work together, and then we decide, okay, then let us try out in this particular group of patients. And then we try it out. And then if we find that there is a benefit, then we start making it into a protocol. And that means the difference between complementary and protocol is that in complementary, the patient has the option to opt in. And in protocol, the patient has the option to opt out. And when it becomes a protocol, the patient has to say, I don't want yoga. But it is complementary, the patient can say, probably I can have yoga. That's the kind of difference that we have in complementary and protocol. At Vedanta, what we have done, we have gone through in 4 years. We have completed 4 years about 6-7 months back. But in 4 years, we had completed around 6,972 patients, nearly 7,000 patients. In about 1 year, from 2013 to 2014, we had around 2,219 patients, and out of which 677 were referred patients for different clinical activities. So what are the diversity of patients who seek integrative medicine therapies at Vedanta? We have a wide array of patients coming to us. Joint disorders are on the top. Then we have people coming for post-surgical management, GI tract problems. There are many. It's like a common general internal medicine OPD that I sit there. Sometimes I get more. Sometimes we get more cancer patients than a internal medicine doctor might. But other than that, usually what we see is a general array of patients who come to us for normal therapies. But there are top 5 clinical conditions where patients approach independently for yoga-based support, which is GI tract disorders, sleep disorders, vertebral diseases, diabetes, and weight reduction. These are the 5 areas which we have found as very, like patients come to us directly saying that, do you have something to do in these areas? Specialities refer to integrative medicine support not on the basis of these trends, but you should be aware that this is the population's belief. This is what people believe, or the patients believe. But the specialities in the hospital, which is a tertiary care hospital, do not send me patients because they think that this is the best option. They send me patients when there is an unmet need in the allopathic system. And the strength, and it is also based on the strength of evidence which is available from Ayurveda and yoga. So which are the specialities who refer to yoga, and why do they do so? They send, we have robotic thoracic surgery to facilitate better drainage, ventilation, and early weaning of post-surgery. Cardiothoracic surgery, stress management, post-cardiothoracic surgery, neurology, stroke rehabilitation, neurology, Parkinson's support to improve stability of posture. It's very specific why they are sending me the patient for. Radiation oncology, in breast cancer support, critical care, speeding up of weaning from ventilator, and sleep medicine. These are the different areas where these are the top 6 or 7 areas where patients are sent to us for management. We look at every patient from diet, drug, yoga, and panchakarma approach, but mostly there are few cases where only yoga goes, and there are few cases where only Ayurveda or panchakarma goes. But it is, we have that data and we can actually analyze it. And we have created fluid protocols. What I mean by fluid protocol is it's extremely personalized. You know, we have a general idea this is the way in which a patient is going to be treated, but it is extremely personalized. We have the freedom to make it. We have created situations where for this particular symptom and symptom group, this is what we are going to add. For this particular symptom group, this particular XY therapies will not be added. So that structure has been made, which makes our therapies very fluid. For example, sleep medicine. We have disturbed sleep. Somebody is referred to me from the respiratory medicine team. We look at obstetric sleep apnea, or we look at whether the patient is coming with insomnia. So if it's insomnia, they get a different group of therapies. If it is obstetric sleep apnea, they get a different group of therapies. These are all yoga techniques, and you have Balasana, Markadasana, Magadasana. All of these, you know, I don't want to go through the names once again, because these are all commonly known for all of you. But this is what we do. What have we seen? We have found that in about 129 patients who had come to us, this is long before, this is in 2012, this data is from 2012, we had 120 patients who were from insomnia group and another 9 from sleep apnea. We tracked the patients for about 1 month and we stopped the medications when we found out that how many of them, after 1 month we called them up and asked them how many of them had restarted the medicine. We found that 27% had to restart the medicine. And after 3 months, we again called them up and asked them what they were doing and how they were and what kind of benefit they had. We found that 55% of them had to restart the medicine, but more important, we found that 45% of them did not have to take any medication, and this continued for a considerable amount of time. This is what we do in yoga in our diabetes patients. We use Mandugasana, Shashasana, Uttana Padasana and Pranayam of different varieties, Bhastrika, Kapalbhati, and meditation, of course, very important. And then we have the other 3 groups: cardiology, cancer, and back pain. In cancer, we actually follow the protocol which has been developed by VIGYAN University and published. So we just follow that. We have not done anything. We have started a clinical trial on breast cancer, which is ongoing. So I am not in a situation to tell you what is the result of that, but we have improved upon what has been done by VIGYAN under the guidance of Dr. Nagarata herself. And then we have cardiology. In cardiology, we get patients for assistance in structured management of stress and hypertension. These are the patients. We train them in meditation and pranayam, and also teach them in few therapies of yoga. What we do is very simple. We ask a patient to come along with a person along with them, and then we ask them to videograph what we are teaching them, and we give them in writing. And then we ask the patient to go home and do it at home, and we call them back after 1 week and then check whether they are doing it right. If they are not doing it right, then we again teach them. So in this manner, in about 21 days, we usually see the patient 7 times, and we find that that's a very good model. Like otherwise, patients spend a lot of money trying to come over to meet us. So we try to avoid that. But initially, on the first day, we spend a lot of time and effort trying to teach them. Then we have low back pain, where yoga like Bhramari, Anulom Vilom, and Bhujangasana and Kadi Chakrasana are used. We have seen excellent results in this. We are planning for clinical trials, but there is only 1 clinical trial on yoga. We are right now conducting 5 clinical trials, but there is only 1 clinical trial on yoga that's going on, which is on breast cancer. And this is the protocol on minimally invasive thoracic surgery. I don't want to elaborate on that. My senior colleague and advisor, Dr. Khan, will be definitely speaking about that. What I want to convey as a key message: yoga definitely can improve outcome results in very sick patients, very, very sick patients. We work with patients in the ICU on a regular basis. Today itself, we might be having at least 5 patients who are in very critical conditions in the ICU, and they can be attended to in a tertiary care health facility. Need-based integration of medical systems are essential and useful, and there is a need for systematic research in this direction. These are the people whom I am co-working with. I am blessed with a situation where I can work with a large number of people who are all very well-versed physicians or surgeons who work in a very good hospital, and they all have been sending me patients, and we have been collecting data, analyzing them, and finding excellent results. Starting from neurology, like nephrology to cardiothoracic surgery to endocrinology, robotic surgery, everyone is here. So I just wanted to give you a cross section of. There are more people working with us in this. And this was when the Secretary Ayush was kind enough to come to our department last month. Thank you so much for this time.
Thank you, Dr. Geeta Krishnan, for telling an experience in a Indian tertiary care hospital, the new things, that innovations that you have done. Thank you very much. Our last speaker today is Dr. Ali Zamir Khan. He is also from Medanta. He is the head of Department of Minimal Invasive and Robotic Thoracic Surgery, one of the leading surgeons of that hospital. He is going to tell us about a strategy for better clinical outcomes in Indian patients' objective. There are a few allopathic doctors who are interested in yoga and alternative system. He is one of them, and I really compliment such doctors.
Chairman, sir, members of Ayush Ministry, ladies and gentlemen, thank you very much for this honor and privilege to speak from this prestigious forum. May I start by saying that I am by no means qualified to speak in this conference, because you guys know more about yoga than I do. And I'm going to share my experience from a purely clinical point of view as a practitioner of allopathy who has seen a change in the outcomes in his patients. I call this topic as 200 BC to 2015 AD, an integration of an old ancient practice with cutting-edge modern technology, i.e. yoga, Ayurveda, with robotic surgery, which is the latest technology that's available for performing surgeries in patients. So I call it a fairy tale story led by Dr. Geeta Krishnan of Integrative Medicine. This is the place where this fairy tale story is taking place. Dr. Geeta Krishnan has told you about Medanta. It's really an amazing place to work in, and you will see some of the outcomes that we share with you now. Before I start talking about the effects of yoga in my patients, it's important that you understand what is robotic surgery. Robotic surgery is a technology whereby you take out big tumors like this within the chest, within the lung, within the mediastinum, which is the center of the thorax, even take out a whole lung using tiny little incisions. In the old days, you used to cut the whole chest up, get into the, spread the ribs and get into the chest to do these surgeries. But nowadays, with minimally invasive thoracic surgery and with robotic thoracic surgery, we make tiny cuts on the skin, don't cut the muscles. We get into the chest using cameras and using a technology called as Mr. Robot. I am controlling Mr. Robot, okay? So the robot is not doing your surgery, so don't worry about it. And we managed to get all these tumors and these diseases out of the chest. And why do I do robotic surgery? Because robotic surgery has some added benefits to the patient. It gives me a 3D view of the inside of the body. The robotic arms, my arm can stop here, but the robotic arm can go 360 degrees around. So it gives me more precision. It gives me millimeter precision to be able to work around all the complex structures within the chest. And I can do surgeries like this. This is a tumor which I'm taking out from around the heart. It's a surgery called as thymectomy. So here I am dissecting around the heart with millimeter precision, having a 3D view coming to me, sitting on a console, not scrubbed up next to the patient. And this sort of surgery gives excellent results for the patient. I won't go into more details about this surgery because I can see some people are squeamish. Now, why integrative medicine? And where does it all fit into robotic surgery? Well, I trained in UK as a cardiothoracic surgeon for 20 years, and I practiced there. And when I came back to India, in all honesty, I had no knowledge about Ayurveda, Unani, homeopathy, or yoga. I had no knowledge whatsoever about these specialities. But the good thing about that was that I did not carry any negative baggage with me. So I was there with an open mind when I came to Medanta. Now, in life, whenever I face a problem in surgery or in managing a patient, I turn to nature for a solution. I look for the solution in outside the hospital, in nature. And that's what I do in my clinical practice. The same thing works with Ayurveda and yoga. It's all from nature. It has got no adulteration. Your techniques are all well established. And more importantly, you have 2,000 years of experience, whereas I have only 100 years of experience. So this experience cannot be discarded, and it has to be integrated into my practice to get good outcomes. So what I say is, when in Rome, do as the Romans. And in India, the good thing is that Ayurveda and yoga is naturally accepted by the people as a part of their social conditioning. So when in India, do things which makes the Indian patient feel better. And that is where I approach this concept of integrative medicine. So where did it all start? I do these surgeries with tiny cuts on the chest wall. Sometimes when they heal, the scars can actually trap the nerves on the chest wall, and these spots or these small scars can be painful. So though the surgery has been done very well, the patient's gone home, he comes back into my clinic and he's got this niggling pain on the chest wall. That's when I met Dr. Geeta, who's got an office on the same floor as me. And we were just discussing, and I said, Geeta, these patients are having pain on the chest wall. You know, I'm doing all these big surgeries, no cuts, but still there is some pain. Is there something that you can do? And he said, of course I can help you. Why don't you send them to me? So for me, it was just a trial. I said, I have nothing to lose. Whatever he does may benefit the patient, may not benefit the patient, but at least let's see if it works. And that's where we started. So it actually started with pain. So whenever a patient had pain in my post-op clinic, I would send them to Geeta. More importantly, they got off my shoulder and they went on to Geeta's clinic. So my headache was less. Any which way, Geeta gave them 10 sittings of local oil fermentation and medication. These were all his tricks and techniques that he uses. I can't even pronounce any of these. And he used them to make the patient feel better. The patient got therapy. The patient got the fermentation, and he came back to me and said, I am feeling better. The pain is gone. And for me, that was a revelation. And I said, you know, Geeta, if you can help me with my post-operative patients, can you integrate with me with my pre-operative patients? So like I said, all my patients, the chronic pain cycle was avoided. So Geeta came up with an idea saying, actually, yes, I can help you with your pre-operative patients as well. I said, what can you do pre-operatively? And he said, I have a yoga therapist called as Dinesh, and he introduced me to Dinesh. And he said, this guy can teach your patients breathing exercise pre-operatively. And then, once they have had their major surgeries, they can have this post-operatively. I said, hallelujah, let's have a look. So all my patients, when they came to me with a diagnosis of cancer or tumor or whatever, at the same sitting, once I've counseled them for surgery, I would send them to Geeta. And so he was part of my regular clinical practice. And then Geeta and Dinesh would design a yoga protocol for these people. And we would teach them these exercises. And then we would do the preoperative pulmonary function test. Because anything that you do, if you want to show a benefit, there has to be some numbers, some scientific basis to show that your outcomes are actually working for these patients. And any which way, we needed this pulmonary function test to see for fitness for surgery. These patients were taught by Dinesh all these poses, which you guys know better than I do. And I've learned them from Dinesh. And there are very, very good names. Anulom Vilom, Brahmari, Shitli, Shitkari, and I'm not even pronouncing it right. I promise you, I'm not a yoga therapist. He taught them all these small exercises for the various joints. He taught them exercises for the hips, for the foot. And these patients came to theatre. They had major surgeries, supra-major surgeries. Okay? And they came out of theatre, and within 4 hours following my supra-major surgery, Geeta and Dinesh were back with the patients, trying to get them to do the breathing exercises again. Now, this is fantastic. Even in the ICU, they were doing rounds on my patients to make sure that they were doing breathing exercises. Now you got to remember, my patients, when I operate on a lung on one side, I actually collapse the lung during anesthesia to be able to get in with the camera. For me, the post-operative recovery is really improved if this collapsed lung completely re-expands and the oxygenation of the patient improves. This was very, 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 very important. And this happened with Geeta's intervention. Also, if I'm operating on the right side of the lung, I am taking down the lower lobe with the cancer, which means I'm leaving an empty space there. If I do not get the rest of the lung to re-expand and fill up the space, that space will be filled with fluid, which is not what is the outcome that I desire. And Geeta and his team were making sure that my patient within 4 hours of surgery were blowing the lungs gently, inhaling, exhaling, and re-expanding the lung to fill up the space so that the overall results of the pulmonary function test were improved in this patient. And we managed to show that with data and with science. We taught every single patient yogas pre and post. Every patient was mobilized. No patient in my hospital is allowed to lie down in the bed after 5 to 6 hours of surgery. Because when you lie down, that is not a physiological position. You will collect phlegm. You will not get the phlegm out. And so mobilization for me was very, very, very important to get good outcomes in thoracic surgery. And then we got pulmonary function tests done, and we measured the amount of fluid that was coming out of the drain in the drainage. And we wanted to show that actually getting the lung to re-expand and fill up the space reduced the drainage in the drain. Thereby, next morning on my ward round, I could take the drain out. And the moment I took the drain out, the patient was mobilized and he was ready to go home by evening. And that's the beauty. A supra-major surgery, being admitted in the morning, having his surgery at 1 o'clock in the afternoon. By 5 o'clock, Geeta and his team are there with the patient, already getting him out, mobilizing him. Next morning on my ward round, the drainage is minimal, the lung has re-expanded, the X-ray is showing that the lung is completely expanded. I say take the drain out because the drain causes pain. It runs between the rib space, so it causes pain. We take the drain out. Again, Geeta's team comes, mobilizes them, walks them around, and by evening I say, this patient is ready for discharge. And that was the outcome that we achieved using Geeta's intervention. So what were our this thing? Well, the other thing is not only did we do this as a one-off, because really these are guys who've had cancer. They need a lifestyle change. They need a lifestyle modification. So we got a complete team involved. We made yoga as a part of their everyday lives. So we made a home exercise plan, and when they went back, they started doing these exercises as a regular event in their life. And more importantly, not only did the patient, but the patient's relatives also got involved, and they also started doing exercises. And that is the real outcome that we found with Geeta's treatment. All these patients were followed up at 6 weeks to see what was happening, and we were really, really amazed to see the results. In the last 2 years, 206 cases having had supra-major surgeries. We measured their pain scores, we measured their post-op PFT, and we found that the FEV1, which is the forced expiratory volume in the first second, which is the most important volume to know how good the lung is functioning. It's when you blow out. If that is good, that means you're doing well. And I know that yoga exercises improves the FEV1. And not only in a normal patient, it was improving FEV1, even in patients who were post-operative, who had lost a piece of their lung, were actually coming back to their pre-operative FEV1. And that was the biggest challenge, that was the biggest change that we found in our patients. Atelectasis. Atelectasis means collapsed lung, because collapsed lung is not good. You've got to have a completely expanded lung full of air. Otherwise, you will collect phlegm and you will get infection. Our patient showed that the atelectasis was decreased. Our patients showed that there was less superficial chest infection in this group. And more importantly, because we've operated on the chest, these patients, because of pain, keep their hands like this. They don't want to move their hands. But because they have been taught these exercises and they're doing shoulder exercises, they're doing all these movements, their shoulder stiffness was not there. All this group of patients did not have shoulder stiffness following our supramajor surgery. We also looked at our pain medication, and we found that the people who had yoga and who had alternative therapy and complementary medicine were actually needing less painkillers. Thereby, the narcotic effects of the painkillers were lost to these patients. And most important for us was that these patients, because the pain was less and they were discharged early and they were mobilized early, they were returning back to work early after having had supramajor surgery. Psychological benefits. What about psychological benefits? This is really, really important, because really these patients don't want to be in hospital. One day they were fine. Next day they had a chest x-ray which showed a mass. Third day they had a CT scan. And fourth day they are in my operating theater. They are psychologically distressed. And Geeta's therapists have a magic around them. Honestly, Geeta and his team have a magic around them. When they sit down and talk to the patient feels comforted. They spend time with the patient. We are very busy. I've got so many patients here, there. I don't have the time to sit down by the bedside of the patient and hold his hand. But Geeta's team does that. And most of my patients actually say that they love Geeta's ward round rather than mine. And I'm okay with that. I'm okay with that, because really psychologically they're feeling good and they're getting home faster and they can do these exercises at home. And most importantly, the chronic pain cycle which comes with not treating pain early is avoided. Increased patient satisfaction, as I said, and really I say this emphatically. I have no hesitation in saying this, that my patients love yoga and they love the massage sessions that they have with Geeta. Sometimes I suspect they come to hospital only to see Geeta, not to see me, post-operatively, honestly. But that's the reality. Well, in Medanta, we have made sure that yoga is mainstream. Integrative medicine is mainstream. His office is not in the basement. His office is on the same floor as my office. 4th floor, next door, cardiac surgery, thoracic surgery, integrative medicine. The massage room and the therapy rooms are on the same floor as my clinical rooms. My patients are there. Some patients will have massage, everything. And his consultation fees are equal to my fees. So we don't discriminate. His therapy is just as important to my patients as my therapy. And so all fees are the same. I think there are challenges to integrative medicine of cost, expertise and training, but the bigger challenge is to change the mindset of surgeons, to change the mindset of physicians, to address the lack of education and information, and more importantly is to overcome cynicism that allopathic doctors have towards alternative medicine. This thought process, that this is Indian medicine and yoga and this is allopathy. This needs to change, and this is what we are trying to address. We're trying to change this thought process. And by the way, these are my 2 children, okay, very sweet guys. So I think it's time for multi-institute, multi-speciality collaboration with common research goals, with an exchange of ideas and exchange of resources. What is next in robotic surgery? We are going broadless, we are going wireless. I can sit in Gurgaon, operate on a patient in Mumbai. I can sit in Gurgaon, operate on a patient in Switzerland. It's all possible. I can do that. I can do a single hole and put in a special robot called a spider robot which goes in and can do the whole surgery. What is different in integrative medicine? What is the future? For me, I am now starting to operate on patients who are awake. I don't want to give them anesthesia. We have started operating on patients awake. Just give them local blocks and get into the chest and do the surgery. This is where Geeta can help me. He can give me intraoperative meditation because these patients are awake. They are listening to some music. Maybe he can give me some holistic music therapy for these patients to calm them down. Maybe he can teach them some exercises to do during the surgery. Foot exercises, hand exercises, prevent DVT. We don't know that. And that is the next step, I think, for integrative medicine. Also, intraoperative use. I want him to give me some plant products which can kill the cancer cells while I'm there. Because when I take it out, I don't know about the microscopic spread. I'm hoping Gita gives me something to help in the theater. I'm hoping he gives me something to put within the wound to promote the healing. I think that's the way forward. The reality is that the integrative medicine and yoga and all these specialties, this train has left the station. That's the reality. It's going to go with you or it's going to go without you. No longer is it a question whether is this mainstream. It's not a question. Only question you have to ask yourself is, do you want to be on that boat, on that train, or do you want to be left behind? That's the key question that you have to ask yourself. Why should you change? Why must you have integrative medicine as part of practice? Because there was nothing wrong with this. You could call London, Paris, New York, no problems. But you did change because technology became better, things became better. We are not enemies. Allopathy is not enemy of Ayurveda. We should all get together. Yoga is not an enemy of allopathy. We are all together. We've got to do it for the benefit of the patient. The only thing that matters is the benefit of patients. So my question is yoga mainstream? We can see it. International Yoga Day happening today. The answer is a definitive yes. Thank you very much.
Thank you, Dr. Khan, for your outstanding work that you have been doing. I am sure everybody is really impressed. And you rightly said, we need to change the mindset of the allopathic doctors. This is what I think the aim of this yoga day is: harmony. Harmony among all the disciplines. If this occurs, is going to benefit quite a lot. Already there are several studies Dr. Nagaratra has done, Dr. Vijay Lakshmi from All India Institute has done. After bypass surgery, the recovery is much quicker, and these patients also not scared of the surgery. You see, many patients, heart patients, are scared that they will die during surgery, and if they are taught meditation, it has been shown the results are much better. Thank you very much, Dr. Khan. You are one of the few people who have done outstanding work, and congratulations to you for your outstanding work.
Dr. Gita deserves the...
Of course, Dr. Gita and both of you do, because it's really harmonious development which is together. Yes, I think with this we come to the end of this session. We have already taken extra time. I don't think there is time for any questions. I just like to just summarize. Okay, only one or two questions. Yes.
So there's a mic there. If you can put on the mic, please.
Can I ask?
My voice is okay. Okay, hello. I have no question. I have only a suggestion. In most of these international congresses which are happening, you make it only one-way traffic. Please speak less. The speaker should be speaking less. It should be a charcha discussion. Allow the audience to participate. What you talk here, we all read in the newspaper or in the books. This should be a level of this. I am Professor Dr. D.S. Agarwal, Yogi Ji. I go all over the world, and I find outside that they talk of things. They don't. Dr. Khan, his senior Dr. Naresh Tirana is my student of yoga. I am very happy. My point is only to that make this discussion open to all, so that you can have more participation of the people. My question is that, is yoga or siddhis are a reality or is a myth? Why people laugh at yogis when they spend a lot of money in hospitals? Why should a yogi go and spend money on hospital? They should not. Let the body go to hell. Let it go, because body is going to go to Swarga or Nar. Please ask the yogis not to go to hospital at all. Just for experiment they can go. They should not spend the money of the people. Thank you.
Thank you for your comments. I think we will have any other question.
Good evening.
Yes.
Good evening, sir. I just have one question for either Dr. Gita or Dr. Khan. If you can give us some idea of the duration of yoga that your patients did, pre-operative or for any of your exercises. What is in terms of hours or weeks?
Dr. Gita, would you?
We start with around 20 minutes of session 2 times before pre-operative, and then make sure that the patient knows exactly what is to be done. And this usually happens one day before the surgery, or the evening before the surgery, the patient is admitted. That is when Dinesh, my colleague who sees the patient and sits with them and teaches them. Actually, he spends around totally 40 minutes, 20 minutes, 20 minutes, 2 sessions. 2 sessions because first time we teach them, they don't remember many of the things. And the second time he goes back and sits with them and confirms that they know. But it's a very short duration of time. And immediately post surgery, whenever Dr. Khan's team calls us saying that the patient is ready, please go back to the patient. Dinesh goes back and starts sitting with the patient. Maybe he spends around 20 minutes definitely, but sometimes he spends up to around an hour of time with the patient to begin with, because at that time the patient is coming off the sedation and it is not completely responding. But over a period of time, let us say the next day onwards, it becomes much better. So in a period of 4 days or 3 days, we will be spending totally 40 minutes to begin with in pre-operative, and 20 minutes and 20 minutes plus another 20 minutes. So 1 hour, 40 minutes is what we totally spend with the patient, really, for yoga purposes. But Dinesh actually spends a lot more with the patient, trying to mobilize them, trying to help them to do the physical activities, etc. But all put together, it might be another 1 hour. So not more than 2.5 hours of time is spent with one patient.
In an ideal world, we would like this to be 4 weeks, but you got to remember that these guys have been diagnosed with cancer. You can't wait 4 weeks. So they come to us and they need surgery ASAP. So that's the time you get. In a COPD patient or in a bronchiectasis patient who's going in for a lung volume reduction surgery, I actually want 4 to 6 weeks of therapy prior to operating on them, because this is an elective surgery. So 4 to 6 weeks is the ideal one where we can actually show the huge difference in lung functions.
Yeah, I think you have to make your own protocols. In New York Hospital, Presbyterian, they admit 2 days before bypass for meditation, and they teach very simple. Similarly, Dr. Nagaratna and Dr. In All India Institute, they have devised their 1 or 2 days before that. But it has to be very, very simple meditation so that it can be carried on during surgery sometimes, and immediately that they come out with some music, etc. and so on. So you have to devise your own, but it is a fact that if you integrate the ancient system with the modern medicine, the recovery and the hospital stay is much less. It has been calculated. It is much more economical. The hospital saves time, the money also, and the country will also save money. There will be a lot of calculations done if you integrate. But unfortunately, I think the mindset of the doctors has to be changed. That's the only way that
I must congratulate Medanta and Dr. Khan, Dr. Geeta and the entire team for this wonderful revolution which you have started in Medanta. And I think the other hospitals should listen to this, and Dr. Khan, you should plan a conference where the other hospitals can duplicate you.
I don't know where you are.
I'm here. Because the time has come for integration, the time has come to give results to the patient, where a lot of patients are suffering, a lot of money is being spent, but they're not getting the results. But now the time has come for the union. Yoga is union. Let's get united and serve the nation.
Absolutely.
Yeah, I think so. We should have more discussions with the modern doctors so that they know the benefit of this integration. Your point is very well taken. Any other?
Don't you have to devise protocols for each patient separately? No. It's a very unique challenge, actually.
Yeah, it is. It is.
Or is it a general protocol you can develop for a group of patients?
We cannot do it on a general protocol, but we actually have a set of pranayams and simple techniques which are very easily doable. And for certain patients, we avoid certain. We don't add anything new, because we have a certain protocol which we follow very regularly. But depending upon the patient's capability, we sometimes avoid few pranayams or avoid few yogasanas, which the patient might not be in a condition to do at the particular moment. So that's how we do it, sir.
Yeah, I have been working with very sick patients. You have to make protocol for every patient. Some patient may be having osteoarthritis, they may be very old, they may not be able to even sit down and so on. So I think you have to individualize the protocol as they have done it. A good yoga teacher knows what type of practices to give. That's what we find, that once they are working with the patients, they know.
That's
I think with
allopathy is much easier.
The last one.
Allopathic doctors have different protocols.
No, we are, in our hospital, we are actually very happy to follow what Geeta advises, but I do actually tell him some things. One, if the patient has got cervical spine problems or this thing, I will actually warn his guy not to do those exercises. The other thing is, if I have done a lobectomy, which means I have stapled the bronchus, there is a raw wound on the inside of the lung, I don't want him to do a very strenuous deep breathing in, because that will blow out my sutures. So these sort of things I will tell him, that avoid this, avoid that. But predominantly he will design what is, and the patient also will tell you what he can and what he cannot do, to be honest.
Thank you very much. I think with this we come to the end of the session. We have already gone beyond time, and let's thank all the speakers for their extraordinary and outstanding presentation. And thank you each one of you.
Thank you so very much, sir, for this very rewarding and inspiring session and sharing your outstanding and revolutionary efforts and your research work with us. And we would like to express our thanks by presenting you the memento. May I request Dr. Manchanda to kindly do the honors of presenting the mementos, thanking all our speakers. Thanking Dr. B.N. Gangadhar. Our thanks to Dr. Raghuram. Dr. Nagaratna Raghuram. Thanking Dr. Geeta Krishnan. Many thanks to Dr. Khan. And may I request Dr. Katoch to kindly present the memento, expressing thanks to our session chair, thanking very much Dr. Manchanda. Thanking once again all our distinguished speakers for this very enriching session which we had, a valuable session, lot of learning, lot of to be imbibed, as mentioned, yoga, a real healing power. Scientifically proved now and also being incorporated in allopathy. Ladies and gentlemen, thank you to all of you also for being a part of these discussions and deliberations. Just to apprise you, as someone had mentioned about the interaction, tomorrow we are going to be having a 2-hour panel discussion which is going to be inviting a lot of interaction from the audience also. Today it was more of a presentations and the work which was shared by the speakers. Tomorrow we have a 2-hour dedicated session which is going to be also inviting discussions from you. Tomorrow morning we are going to be starting at 9 o'clock, so you're requested to be kindly seated before that. And ladies and gentlemen, from outside we have the buses plying, taking you to the Ashoka Hotel. As you might be aware, we have a cultural program which is going to be commencing at 7:45 in the evening. People who are interested in part of it, you're requested to kindly use the buses which are outside. They are going to be starting now, flying from outside. And tomorrow morning, we look forward to once again having you here. 9 o'clock is the first session. Thank you and namaskar and enjoy this evening.